What'd she say? All right, okay. Well, good afternoon, everybody. And thank you for staying so late. Got the last talk of the conference here. First of all, I want to thank Tim Siegel again for inviting me. And I told him as long as he keeps having this conference, I'll keep coming, and because what he's doing is so important in trying to disseminate this information about treatment of brain injury rehabilitation and what can be done. So, salute to Tim. All right, well, I'm going to talk about hyperbaric oxygen therapy and hyperbaric oxygen therapy in pediatric neurology. And I have a lot of slides here, but I want to start off with a central message, and that is that the decision you make whether or not to do hyperbaric oxygen, if you do it, is in fact a very personal decision. And it's a sensible, responsible decision. In fact, you can argue that it's evidence-based medicine. You're going to hear that term a lot in medicine. The doctors, we only practice evidence-based medicine. In fact, there's substantial cumulative evidence that hyperbaric oxygen can be effective in the treatment of a wide variety of pediatric neurological conditions. And that's what I kind of look at. Well, what is evidence-based medicine? This is what the original definition was. And if you look at the bottom here, you can kind of sum it up. It's not randomized trials, which is what doctors want to tell you. Oh, there are no randomized trials for your therapy, so we can't do it. No, it's actually the best research evidence coupled with the doctor's clinical expertise and patient preference or values. So you have a say in what you want done to your child. And it's the most important part of the equation there. So hyperbaric oxygen therapy, I want to start out with a question that's really vexed this field for 360 years. And I don't know if any of you are aware, the first hyperbaric treatment was done in 1662. So here we are 360 years later, and still this specialty hasn't been able to answer it. But we're actually doing a drug therapy, if you will. But it's two drugs, oxygen and pressure. And that's what we're dosing in trying to apply this. And we all know that oxygen is responsible for life. But nobody's ever thought about pressure. And, what is pressure? Well, it's something we live with, we think about, but we don't really acknowledge. Pressure, at least on Earth here, and we're close to sea level, is the weight of air from here to roughly 62 miles or 100 kilometers up in the atmosphere, or the equivalent going below the surface of water. So this is a complicated graph here, but essentially this is 60,000 feet altitude, almost zero pressure, and here is all the way to 2,000 feet below sea level. And this is the little range that we're operating in with hyperbaric oxygen, and right there is sea level pressure. Well, this is kind of the safe zone here. You might need some oxygen to help you out in there. But we can look at it kind of figuratively and how this works. It turns out that different species are adapted and live at different altitudes. And the same thing happens with plant life and even livestock. They seem to thrive at different elevations. But it's also true when we go underwater. There are different species of plant life that live only at certain depths in the ocean. And same with the fish life. Certain species are only found at certain depths. So it is a intrinsic factor that we were created with, or if you're an evolutionist, what we were evolved with. We are all sensitive to and adapted to pressure and an oxygen level, and we are equipped to be able to change and adapt to changes in pressure and altitude. So here is the weight of air from 100 kilometers or 60 miles above us. That column of air where we're standing right now, there's 14.7 pounds per square inch of air going all the way up 60 miles. Similarly, the exact amount of 60 miles of air you can duplicate with 33 feet underwater. So the weight of water on you, to that point there, 33 feet would be 1 atmosphere of air. Well, the only way that you can really increase pressure for the human body is to fully enclose it and pressurize it, or go to a place that's below sea level, the Dead Sea. And in fact, experiments have been done where they've taken people from Jerusalem to the Dead Sea, and it's the amount of change that you can get in about a portable chamber, hyperbaric chamber, and they've shown that it's effective for lung conditions and potentially other things. So you have to enclose somebody in a hyperbaric chamber. Well, it turns out every chemical reaction in our body has a pressure component to it, such that when we change pressures, we are affecting potentially all sorts of chemical reactions in our body. But more than that, what in fact we're affecting, and this has been unknown until 12 years ago, or 2009, so 13 years ago, is that when we expose our body to changes in pressure and oxygen, we stimulate the expression of genes, some 8,101 of them. That's over 40% of our 19,000 protein coding genes in our 46 chromosomes. And the largest groups of genes that are turned on are the anti-inflammatory genes and the growth and repair hormone genes. Largest clusters turned off are the pro-inflammatory genes and the ones that code for cell death. So every time you get a hyperbaric treatment, you're stimulating tissue growth, inhibiting inflammation, and turning off cell death. All right, so what is hyperbaric oxygen? Well, it's use of increased pressure and increased oxygen to treat not necessarily diseases, but the disease processes that cause the diseases. And it turns out all living organisms are sensitive to this. And what it has its greatest application is in treatment of wounds in the body, in any location and any duration. And if we look at what a wound is, essentially it is a damage to underlying tissue. But of course, we also have emotional wounds, and we now know that even emotional wounding causes tissue damage, even brain injury over time, due to the effects of stress and stress hormones. But essentially, it's an internal wound. So we're used to looking at external wounds. The scrape on the knee, a cut, it's actually a stab wound, a burn, an external wound, and this is a patient of mine that we treated for a burn, that's after hyperbaric oxygen. It has dramatic effects on reducing swelling, but we're not so used to thinking of wounds internally. But isn't a broken bone an internal wound? Yes, it is. It's got tissue damage with it. How about something in the brain? Of course. You can have a wound in the brain. Well, what kind of wounds? You can have a stroke. How about a birth injury? You know, we're used to seeing children with birth trauma come out with hematomas on the head. That's usually a sign of trauma to the child. What happened inside the brain? There's very often wounding inside the brain. It's often dismissed as well. You know, here's a birth-injured baby. Well, if we look at wounding, what are the common disease processes to a wound? They are low blood flow, low oxygen, and inflammation. And it turns out that's what we're treating. Well, what examples do we have of this? You can look in the brain, and how about a stroke? So there's an MRI, and you can see the injury there. Now, what is an MRI? It's a proton signal. It's an electromagnetic signal. And so, you know, doctors, unfortunately, are in the habit of looking at anatomic images, they come out MRI, and telling you, oh, the brain is dead. Well, no, it's not. Take a look. Here's a blood flow image showing that there's even blood flow right in the area of what is considered the stroke, the dead brain. So this is an anatomic image. This one is a functional image. It's looking at whether brain cells are dead or alive. Well, what other examples of wounding do we have that affect blood flow and oxygenation? How about radiation injury? This, in fact, constitutes 40% of all clinical hyperbaric medicine in the United States that's done in hospital settings. People who have radiation injury for cancer treatment. So if you look at how this is done, with the external beam of radiation, which is this red beam here, but you now direct it, you know, multiple different directions to try to hit the cancer there, so it doesn't all get the same beam. But the problem is, if you look at that beam and what happens 6 months later, And if the beam is going right down the center here, it kills blood vessels. So yeah, you kill cancer, but you kill normal tissue too. And what you end up with is an internal wound that has a gradient of oxygen and blood flow. But it's an internal wound. And that, in fact, is what hyperbaric medicine is treating in most of the hospital settings, is late radiation injury. Pelvis, mouth, wherever the cancer was. Well, where else do we have an example of low blood flow, low oxygen? How about COVID-19? Anybody looked at the lungs in COVID-19, where the primary pathology is? Here's normal lung tissue, this fine kind of filamentous tissue with the air sacs. There's the COVID lung. And look at those fine little septa, how full of inflammatory cells, and then they leak protein, which is this red stuff filling the air sacs. And that's what the chest x-ray looks like, and that's what people die of, especially when they're on the ventilator, where the ventilator then damages the lungs. But again, it's a wounding of the lungs. How about autism? Autism in the 1940s was described as a psychiatric condition. Now, what's wrong with that picture? A psychiatric condition in a 2-year-old? Come on. Adults have psych problems, but I mean a 2-year-old. No, we now know it's a physical injury to the brain. It can be from a variety of different things. But if you look at autism studies in children with brain blood flow, 90% of them are showing abnormalities in the temporal lobes. So this is a brain blood flow scan, and we're looking at the person face on. This is behind the forehead, the 2 frontal lobes. The eyes would sit right here. Here's the temporal lobe. Normally it looks like a hot dog bun. It's kind of a circular structure, very smoothed, and that's the reconstruction of it. But you can see how hollowed out it is. And these are the primary areas and the lower parts of the frontal lobes there where you see those holes. There's the temporal lobe. Normally this is an inverted U like that, but you can see the blue there on either side. There's minimal blood flow. It's an injury to the temporal lobes primarily. Well, if we look at wounding conditions, you can kind of sort them into a couple broad categories. One is intellectual disability, and the definition of that is, problems with memory, cognitive function, sensory, speech, language, affect, social skills, a whole variety of things. But, if you think of that, that describes a whole lot of conditions. Wounding conditions, cerebral palsy, hypoxic ischemic encephalopathy. What's that? What happens after drowning? Birth arrest, or the mother has an arrest during childbirth. Muscular dystrophy, not so much. That's more a genetic problem. Graphic praxis, a problem with doing motor functions, but it's due to an injury to the brain. Head injury, trauma, stroke, neonatal asphyxia. You can go down the list here. Many of them are wounding conditions. The other broad category is intellectual disability, which is IQ below 70 to 75, significant limitations in adaptive skills, which are all of these things here, communication, self-care, etc. If we look at what these are, there are hundreds of these conditions, but many of them are wounding conditions. The most common, in fact, are genetic ones, Down syndrome, not fetal alcohol, and Fragile X. But if you go down the list, there are genetic conditions, there are things that happen during pregnancy, fetal alcohol syndrome, malnutrition, infectious disorders. Physical injury that can occur to the mother, the baby during pregnancy. Then you can have problems at birth, prematurity, low birth weight, brain bleeds, asphyxia, and then after birth. All sorts of things that can affect a child's brain afterwards. But essentially, the vast majority of these are wounding conditions of the brain. And we're going to sum this up at the very end, which will be the message to you. Poverty also has its effects. We don't like to think of that, but the things associated with it, malnutrition, absence of adequate medical care, environmental hazards, exposure to lead-based paint, often in poor socioeconomic situation, older homes with old paint and so on. And then there are other experiences that can result in injury to the brain. Well, if we look at hyperbaric oxygen in the United States, it's been traditionally restricted to what gets paid for by insurance, Medicare and Medicaid. And that's what gets paid for. So this is air or gas that gets in an artery, carbon monoxide, a crush injury like in trauma, diver's disease, decompression sickness, wounds like diabetic foot wounds, massive blood loss, where you're given oxygen in place of blood, radiation injury. They're all wound conditions. And the final 8 here, skin grafts and flaps, surgical procedures, trauma, where the flap is failing, blood supply problem, thermal burn, wound, central retinal artery occlusion, that's a stroke of the eye. It's a stroke in the blood vessel to the eye, sudden blindness. Sudden hearing loss, and then 4 of these infections, like gas gangrene, the flesh-eating bacteria, it turns out they're all wounding conditions. Well, let's go to Russia. They treat 70 conditions. 49 in China, 33 in Japan, 15 in the US. If we look at all of them, there's even been described over the years 132 diseases hyperbaric oxygen has been applied to. I would tell you that it turns out they're almost all wounding conditions and inflammatory conditions. Inflammation is a part of wounding. I've treated quite a few as well. Well, if you treat a wound and you heal it, what must you do? You have to grow new tissue. And so the daily stimulation of a hyperbaric treatment, increase in pressure and oxygen, gives you the output. You treat the underlying disease process and we grow new tissue. To do that, you have to go through the nucleus of the cell. You have to stimulate it to multiply and divide. And nobody ever really looked at this until these gene experiments were finally done in hyperbaric oxygen. What we're doing is stimulating the genes. So this is a picture of one of our chromosomes. And you know the DNA double strand, you can see this double-stranded helix here. It turns out it is coiled. And not only is it coiled, it's an even bigger coil. Well, sitting in the middle of the coil are these proteins, the different colored proteins there. And they have their arms that stick out. It turns out these arms are very reactive. And what do they react to? Alcohol, tobacco, pesticides, food additives, chemicals, fertilizers, stress, sleep deprivation, everything in our lifestyle affects these reactive areas on the protein. And when they do, it changes the charge and conformation on these, and they lift off the gene or they clamp it down. And the gene either gets expressed or it doesn't. And it turns out that's where hyperbaric oxygen is acting. We have a gene therapy here that is either opening up the gene and allowing it to be read or suppressing it. And that's the key to hyperbaric oxygen. So here's the experiment I talked to you about before. 8,101 of our 19,000 protein coding genes. Now we used to think when I was in medical school from 76 to 1980, can't believe it was that long ago, but we thought that our genes were just for reproducing, you know. You get ready to have kids, yeah, okay, you pass on your genes. But in fact, at every second, in every cell in our body, all of these genes are being read to make new proteins that eventually get used and degraded. But it's a constant activity that's going on. And what this is showing, these are human cells that line the smallest blood vessels in our body. All our organs, all our blood vessels, everywhere, these human cells, they took them from some skin biopsies, put them in a petri dish and gave them a single hyperbaric treatment, then measured all the gene output for 48 hours. At the end of 24, that number of genes were turned on or turned off. Anti-inflammatory and growth and repair hormone genes. Okay, well, so we're treating wounded tissues in hyperbaric medicine. We're trying to heal wounds. But it turns out in the brain, it's also the cells that are injured. And this concept, and someone just said this to me in the room there when we were talking about their family member. Well, the doctors, told us that the brain is either dead or alive. Well, no, that's not true. And we know that from heart studies, we know it from a lot of things, but we now know it from the brain. And this was the idea of an idling neuron. So a neuron can be alive, it can be dead, but it can be injured. And it's knocked down to thinking of it as kind of an idling speed. And this has been well shown now in experiments, but it was my mentor, Dr. Neubauer, who took this lady, 60 years old, 14 14 years. People ask, well, can hyperbaric oxygen help me after 2 years? 14 years after a stroke, paralyzed on one side, drooling, no speech, can't chew or swallow, 24-hour care. There is no treatment for her. Here is her. They did the MRI and CT, and of course, here's the dead area. Now, this is a brain blood flow scan. Low blood flow here, highest there. So you can see the big deficit here. Well, on that MRI I showed you earlier, that was always assumed to be dead. But what they did is they put her in a hyperbaric chamber 14 years after the stroke, took her out, and look what happened. In the center area of the dead spot, it lit up with activity. What it said was there are brain cells there that are not yet dead. They're not working so well, but you can wake them up. And this is what we founded a whole treatment program on, along with others. Well, really, when you think about it, it's not so unusual. You've seen these cases before. They appear in the news every now and then. This guy here, Donald Herbert, 43-year-old fireman, ends up in a coma in 1995. Blind, mute, poor memory, in a nursing home. 10 years later, he has sudden intelligent conversation with his wife and 4 sons over a 14-hour period. And then, nobody would talk about what happened afterwards. I mean, maybe they had to take him home or something. It's like, oh. But the point was, how could that happen if his brain was dead, all the cells were dead that had been injured? There had to be some that were injured but not working. And something happened there with blood flow, metabolism, whatever, but they suddenly started to work. This happened with an Arkansas guy with severe TBI. This guy here, a police officer. It sometimes happens with a single drug. This has been known. But the point is, you can have these injured cells that can exist for years. And what it's saying is that, there's an awakening of this. And my mentor ended up doing a study on this. He took 17 patients in coma, gave them hyperbaric oxygen, and essentially was able to bring them out of coma. And these patients were anywhere from weeks to over a year out from their injury. Okay, so the concept of idling neurons, we know that, and this has been seen at least in humans for 19 years or so, are they present in children after a brain injury? What do you think? Of course they are. Why wouldn't they be? Here's an 8-year-old, birth injury. And these now are cuts that are from the side. So they're sagittal. So we're looking at him from the side. His ear would be right in this region here. And the color scheme on this is lowest brain blood flow is black, then purple or blue, purple, orange, yellow, and then this white. So here he is before we did any hyperbaric treatment. And here he is after one treatment the next day, 3 hours after he comes out of the chamber. Now, how can you do that? He has to have brain cells that are not working that are now starting to work, because that flow die requires metabolic activity of the cells to take it up. If you don't have it, it won't take it up. And what it's showing is that they're acquiring activity. Well, what we started doing in 1989 was looking at every patient with a chronic neurological problem who got referred and tried to see if they had idling neurons and if they'd respond to hyperbaric treatment. And what we would do was single SPECT scan. Next day they got one hyperbaric treatment at a particular dose, and then we repeated the scan. And then we gave them 40 hyperbaric treatments, stopped, assessed, repeat the scan, took a break, 40 more treatments, repeat the scan, etc. And we looked to see what we could treat and what would respond. And here's an example of a little 5-year-old boy, autistic, and look at the temporal lobes. And here he was after one treatment. Now, we didn't cure him, but what we're showing is his temporal lobes can respond. And it's consistent with what happened. He improved with repetitive treatment. So anyways, we did this. And then what happened, there was an imaging specialist here in Texas, actually in Dallas, that I had contacted the imaging company to try to get them to give me a scanner so we could do some research and look at this. And they directed me to him, and he said, well, let me just first see what you've been doing. So I sent him the first 19 children we had treated and sent him all the scans. before and after one treatment, and then after 80 treatments. And he did a very sophisticated analysis called statistical parametric mapping. And he took a very conservative value for the cutoff. Well, here they were, the 18 kids. I'm sorry, I said 19. It's 18 kids there. 15 were between 1 and 5 years old. And we have a few older ones. Most of them had CP, but one had a pervasive developmental delay. The other one had air embolism and stroke from a heart surgery. And what he looked at, we looked at him before and after one treatment, and then we compared 80 treatments to the before, and then 80 treatments to one. And what we saw was significant and similar changes in blood flow after one treatment and after 80. And I'll show you a picture of this here. But the key was, look at the areas we saw improvement in. These are gray matter areas of brain with significant neurological function. The thalamus, central sensory area of the brain, caudate, involved with limbic system and emotions, the amygdala, the rage center. You saw heard Dr. Brandon Crawford talking about that. Medial temporal lobe, that's the memory center, short-term memory center for the brain, and the visual cortex, where our vision was. And what we found after hyperbaric oxygen is that the low areas had an improvement, and the high compensatory areas came down and were more normal. It had a normalizing effect on it. And it was similar to the pattern we had seen on these for a long time. So these are the images, not great pictures, but the orange areas are areas of a significant improvement, and the blue areas are areas where there was too much flow and it decreased. And so this was compared one hyperbaric treatment to the baseline. We did a subtraction study. Those were the significant areas. Here was after 80 compared to the baseline. And when we subtracted or looked at the difference between 1 and 80, there was almost nothing there, meaning the changes that occurred after that one treatment where we tested the brain were predicting the areas that then improved with repetitive treatment. They were identical, meaning the test was good. And it turns out it was a very good way to look at it. If we could see improvement after that single hyperbaric treatment, I could guarantee to the patient, the family, that their child would improve with this therapy. It was that good. Now, unfortunately, insurance companies don't like to reimburse for it anymore, and we can't do it that often. We can do it, but it's just very expensive. So let me show you some examples of this. And this was one of the very first children that we started with. And this was a chronic drowning case. So 4-year-old boy, 5 minutes submersion, bottom of the pool, took 45 minutes to return of spontaneous circulation, finally get a pulse. 2 years later, he's in a wheelchair with severe deficits, and we did that sequence of imaging on him, and I treated him 80 times in 2 blocks, 3-week break between it. And what we saw was a generalized decrease in his spasticity, started to move all 4 of his extremities, had head and neck control, his swallowing came back, he was now more aware, nonverbal communication, and his attention span had improved. And of course, we repeated his SPECT. So here they are, and I want you to key in on one area here. Look in the frontal lobe. So in all of these, he's laying on his back, the back of his head is here, face is here, and we're looking up from his feet. So right ear would be there, left ear is here. So the front of the brain, frontal lobe is up here. Look at the color of it, and look what happened after one treatment. Dr. Fogarty, the radiologist, calls this a janitor case. The janitor is walking by in the radiology suite and happens to look at the picture and says, "Oh, that one looks better." You don't need to be a radiologist to read it. It is a gross change in brain blood flow. And then here he was after 80. Again, look at the frontal lobe. Okay. Is there any question about an improvement in these? I don't think so. Well, here's the 3-dimensional reconstruction. So you can see he's got multiple deficits, and especially along the midline. Here's after one treatment, and there he was after 80. Now that looks normal. He's not normal. But because the internal connectivity of the brain is still not normal. But what this is a surface reconstruction of the outer part, just showing that this has now improved in flow and function. How about this? Anybody heard of PANS? Yes. In fact, this is what long COVID may be. PANS started as PANDAS. And it's a neuropsychiatric deterioration after what originally it was identified as strep throat infection. Just some kids, their immune system reacted in a certain way, and they ended up with the immune system attacking the brain. And they degenerated into this grossly dysfunctional psychiatric condition. It affected their cognition, everything. And you'll see here. I've now treated a number of these cases. In fact, this is more common than everybody thought. It doesn't have to be strep. It can happen after a virus. It can happen after all sorts of different infections. And in fact, may happen more commonly than we think. But he was an 18-year-old by the time I saw him in high school. The kid was an A's and B's, well-adjusted, socially played sports, gets swine flu. A week later, he falls, has a concussion. Now, what is the problem there? So swine flu, he's got a systemic inflammation, and now on top of it, he gets a concussive event. Brain may be involved in the swine flu, but this is kind of like second concussion syndrome, if you've heard of it. Get a concussion, and then within a week or two, another one to an already injured brain, and it's a devastating injury. It like amplifies the first one. Well, within a couple weeks, they find out that he's positive for this one echo virus. But he then has cognitive deterioration. He's irritable. He's having to stay home from school, becomes significantly depressed. They're trying on medicines, did an MRI on the brain, didn't show it. Everything's normal. We don't know what's wrong with him. He's got a psychiatric problem. No, he doesn't. And then he gets on an airplane. What happens? In flight, cabin altitude, 8,000 feet elevation, 27% reduction in oxygen and pressure. He's now having worse problems. Gets off the plane, change in behavior. He's agitated, short temper, suicidal ideation, sleep disruption. He stays for a while. He's there 2 months. He kind of stabilizes, gets back on the plane, returns home, has some more problems, worsened behavior. And this goes on. He just ends up in this constant cognitive problem with anxiety, depression. They finally diagnose him with schizophrenia. EEG is globally abnormal. EEG is a hard finding. You have an abnormal EEG, you have a problem with your brain. You can't call it a psychiatric condition. And so here it is showing up on EEG now. And he goes through all sorts of evaluations. And he's finally diagnosed with an atypical psychiatric syndrome, unresponsive to all medications. It turns out he has PANS. He then starts slowly recovering, but he's still hearing voices. He's paranoid. He feels weird. He's got cognitive problems. He's just strange, still depressed, fatigue, lack of motivation, a lot of symptoms here. And what ended up happening, he was on some medications at the time. Family history. There's nobody in the family who's ever had anything like this. He was clean as a whistle, never smoked, drank, drugged, nothing like that could contribute. And mom found out about hyperbarics, came down, and when he walked in, he wouldn't let me video him. Usually I video the children and some adults, but he just looked spooked, eyes wide open, this type of stare about him. Really reticent, didn't want me to touch him. And what ended up happening, we did a lumbar puncture on him, and we found he had elevated inflammatory markers. Inflammation of the brain. Autism, what else? There are a lot of others with this. So we did the brain scan, repeated it after one hyperbaric treatment, and then started treating him. And over time, global improvement, progressive improvement with 40 treatments. He ended up passing his GED, was able to go out in public, started driving, global improvement. We gave him some more hyperbaric treatment, and the long story short is we eventually stopped. He then went on to graduate from community college, then graduated from one of the four-year universities in Louisiana at the top of his class in computer science, and he now has a job, works full-time at a big tech company, but a total save. And so here were his scans before and after one treatment, and you kind of look at this, how it's kind of moth-eaten, and then here it was with improvement in blood flow, and there he was after 40 treatments. Here are just some other images, taking a look at different slices from front to back. before and after a treatment. And then here are the three-dimensional ones. So take a look at this poor 18-year-old kid. Temporal lobes, frontal lobes affected, globally the whole brain. And there he was after the treatment when we re-imaged him. But we went on to treat him some more. Well, how about polydrug abuse? This is the son of one of my colleagues, 19-year-old kid who had a 6-year history of polydrug abuse, 2,000 doses of Rohypnol, the date rape drug. He was using it on himself to induce loss of consciousness. And right before he passed out, this euphoria of low oxygen level was what he really liked. 2,000 times, along with ecstasy, other drugs, alcohol, cocaine, inhalants. And by the time he now is so dysfunctional, having problems in school, emotion, behavior, just really a damaged brain. And we ended up imaging him, treating him, marked improvement. And here were his pictures. So this is 19-year-old kid. And look at that brain. And here he was after one hyperbaric treatment. Told us that we could treat him. We then went on to treat him, and in fact, he responded. So what I'm doing here is going through some examples of different wound conditions, because we're going to come to a conclusion here in a minute. Global ischemia hypoxia. Well, what is that? That's when the brain is deprived of oxygen and blood flow. Birth injury, hanging, drowning, asphyxiation of any cause. And this was an 8-year-old girl, normal pregnancy and delivery, but in the formula had an aspiration and ended up cyanotic. They had to resuscitate her. Parents were told it was a little problem in the nursery, but everything went okay until they got the hospital records and we were able to see what happened. Got hospitalized for 5 days, but by 4 months of age, something's not right. Not coordinated, poor eye movement, blank stare, delayed motor milestones, extensive 2-year evaluation. We don't know what the problem could be. We're going to send you to the geneticist. Maybe this is a genetic disorder. No, it's an ischemic hypoxic brain injury in the nursery. But of course, there's big liability attached to that. Then they get an MRI, and what do they see? A small brain. The entire brain was injured and had atrophied because of the injury. And they tried some various therapies, didn't work. And she has these significant deficits by the time we treated her. Did this imaging sequence and then hyperbaric treatment, repeated it, and we had improvement. Progressive improvement as we treated her, ended up sleeping through the night. So here was that first one. I'm just going to show the three-dimensional. Frontal lobe, temporal lobe injuries, even cerebellar lobes in the back. One treatment, and there she was at the end of treatment. Not normal, but markedly improved. And again, the one treatment predicted what happened. How about CP? Here's a 5-year-old. Premature bilateral brain bleeds at a year of age. They were told, your child will never walk, talk, think, or live very long. The doctors are good at these predictions. They're good at showing that they usually fail, okay? Especially if you can get your child some treatment. And of course, by 5 years of age, global developmental delays. He can only speak maybe 2 to 3 words. So these predictions are already wrong, but it's only when he's prompted. No abstract thinking. Dad decides and heard about what we were doing with the kids with cerebral palsy in New Orleans, and he was in Georgia. He went and decided he's getting some hyperbaric treatment, but got a SPECT scan beforehand. And remember, speech is his big problem. By 21, he's feeding himself for the first time, speaking, initiating conversation, explaining himself, concepts. The kid's got, cognitive function. And then did some more further improvement. And then here are his scans. So these aren't the greatest scans, but look at this big deficit here. Blue area, low blood flow. What is that? That is called Brocas area 44. It's our speech motor area. So in all of us that are right-handed, dominant hemisphere is the left hemisphere. Your speech motor area is right there where your temple is. Well, look what happens to him after 21 treatments. Another janitor case. And of course, what happened? He's now speaking, along with all the other things, because the brain was treated globally. Well, 5 years later, when he's 10, his dad brought him to New Orleans. And actually, I had been in touch with him all along because I want you to go to the Medicaid for HBOT website. This dad fought Georgia Medicaid and got Medicaid to reimburse for the hyperbaric treatment. First state Medicaid program. And I helped testify in his case. Now there are over 25 states that have done this. So if you got the fight in you, there's a way to go about doing this, and that website will help you with it. But 5 years later, it was like, well, can hyperbaric oxygen help my son further? I said, well, let's test him. So we brought him down, and here he was. So there still, he's not normal. He still has some speech problems, temporal lobe, etc. And that was before one hyperbaric treatment, and there he was after that one treatment. And he went on to get some additional treatment and some further neurological improvement. So we're coming towards the end here. That little guy is Jimmy Friels. He subsequently went on to, and his dad, his name is everywhere, I'm allowed to use it. Graduated from high school, college prep diploma, and 3 years ago graduated from Georgia State with a bachelor's degree. I don't think we need to go back to the slide. Your child will never talk, walk, do anything, and have a short life. How about this one? Shaken baby, 6-month-old baby girl. Normal pregnancy, delivery healthy at 2 months. Father repetitively slammed the child on the crib bed. 2 separate incidents. And finally, mom comes home, finds the baby listless, taken to the hospital, cardiac arrest, prolonged hospitalization. 4 months later, mom brought her down to me. No smile, no social interaction, paraplegic, mostly G-tube fed, seizures, and we did the imaging, single treatment, repeated it, 40 treatments, took a break, gave her some more. She reacquired vision, smiles, social interaction, seizures resolved, and she started moving her legs when she was in aquatherapy. Now, she was supposed to be densely paralyzed, no spinal function, and no chance. Okay, that's her 3D. Now, you've seen all the other ones. She essentially, that doesn't mean she has no blood flow, but you can see it very faintly here. And the color, there's very low blood flow to her brain. Well, so what we're imaging here is the base of the brain stem, and part of the cerebellum. Here she is after one hyperbaric treatment. Okay, that's not huge, but it showed that her brain could possibly respond to this, and she did. What's that little area right there? That's her visual cortex. So remember, she's blind. Well, she reacquired vision. And when we were done, here was her treatment, and there was her visual cortex. So not as good as after one treatment, but again, that pulse shows more potential. And then how about this one? Postencephalitis. 13-year-old girl, 2-week febrile illness, seems like the flu, but it finally culminates in status epilepticus, uncontrollable seizures. They took her to the hospital, put her in a pentobarbital coma for 46 days, 2.5 months in a rehab hospital, came home, parents couldn't control her. Locked down the house, they had trouble keeping her in the home, controlling her behavior. She then got transferred or taken to a lockdown hospital rehab for 4 months, where the only way they could control her was with heavy psychoactive medications. Finally, the parents said, look, this isn't working. She's no better, maybe worse. We're taking her home. Hospital refused us. They had to get a Louisiana congressman to through the government channels, get this hospital, which is one of the most famous ones in the country. It's where I went to medical school, to release the child to the parents. And they take her home. They had to build a separate room that they could school her in and try to do some type of schooling. And curiously, she'll start to speak when she's in water. So when she's in a pool and floating, she'll start to talk. I mean, it was like, wow, what's happening here? Well, we know that when you are buoyant or in water, it changes blood flow to your body. You actually shunt it from your extremities to centrally to the heart, lungs, etc. Who knows? She may have been perfusing her brain better. But anyways, here are her problems. Violent, essentially beating up her parents. She's a good-sized 13-year-old girl. No personal hygiene, won't take a bath, won't go anywhere near it, not toilet trained, so they can't even get her to the bathroom. It's just a terrible problem. No social interaction. She can't go out of the house. Cognitively, she's pretty impaired. And here she was. So we did an image on her, and then you can just see she's got a diffuse injury, temporal lobes involved, midline, frontal lobes as well. And the after-treatment one didn't show a dramatic change, but I want you to look at her temporal lobes. So temporal lobes, remember with autism, that's where most of the injury is. It turns out our temporal lobes are very much responsible for emotion and behavior. And there she was after one treatment. And what we saw was overall kind of global improvement, but we saw some improvement in the temporal lobes. And we started treating her over a period of time, gave her 40 treatments, remarkable improvement, all of her problems, no seizures while we were treating her. And she had a curious seizure phenomenon. She was only having seizures with her periods. So, with hormone withdrawal for the brain right at the start of the menstrual cycle there, brain is very sensitive. PMS is a real syndrome, but it also can affect other things. It turns out these areas of the brain were also the areas where her seizure foci were and where she would express them. She then improved some more on her break. We gave her some more treatments, and during the first 15 to 20, her mother said, "This is pure heaven. She has not been this good since the injury. She's cooperative. She's talking with us. We're just making all this progress." As we kept treating her, though, she started regressing. The last half of the treatment, she started getting a little violent again and so on. Well, what was going on there? We gave her too much. You heard Dr. Crawford mention this earlier, the double phase. Too much, too little, just right. Well, this is like any other drug. And this is what the key to hyperbaric medicine is. We're dosing a drug. And you can overtreat. But if you recognize it and stop, what happens is she bounced back within a week, was doing good. And what happened then, we began to treat her again, had improvement, continued. She started going to school. Her seizures became just tiny little twitching type of episodes. All the doctors she went to see were dumbfounded, including this one, the chief neurologist, who has been extremely critical of hyperbaric medicine. 4 months later, further improvement. And then over a period of time, I tried to see what she could continue to respond to. It turns out it was 2 to 3 hyperbaric treatments. And we'd see this improvement. We'd stop, take a break, and with each one of them, she would have further improvement in her hygiene, self-care, and so on. So if we sum all of this up, what did I just show you? A CP case, an autism case, air embolism, PANS, polydrug abuse, global ischemia, shaken baby, postencephalitis. These are all wound conditions of the brain. And what it implies is that we have a generic treatment for wounding conditions of the brain. So what's the question you really need to ask? Does my child have a wound in his or her brain? Could it happen? Or did it happen? Did it happen at birth? Did it happen? What's now been shown, these innocuous head injuries that can occur where a fall hits the head and then the child vomits or gets sleepy afterwards and then seems to be okay. Take him to the emergency room and they may image him. Often they don't, but he's okay. Look at him. He's walking around or whatever. They actually can induce injury that can alter development. And this is now much more recognized than it used to be. Well, if we can answer that question, your child has a wound to the brain, we've got evidence in CP, in autism, in some other studies out of Russia and even internationally, in a variety of different conditions. There are 31 controlled studies in China treating children with acute birth injury. 31. Now, they're not the highest quality, but they're based on the principles of early treatment and the pathology, the disease processes you are treating. And the outcomes are positive. Well, it turns out we can say that we've got evidence-based medicine for treatment of pediatric brain injury. And so, conclusions. We're using a 2-component drug, or I should say 2 drugs in one. One is pressure that nobody has ever thought was bioactive, and the other is oxygen. And I'm going to digress just for a second here. I was in hyperbaric medicine 26 years. Went to a lot of conferences, read a lot, wrote chapters in textbooks. We started a fellowship. Never in 26 years in the entire field had anybody mentioned that pressure can have an effect. It was always increased pressure of oxygen. And then in 2011, I submitted a request to the Food and Drug Administration to sanction a study we were doing on traumatic brain injury that's since been published. And they said, this is the first time hyperbaric medicine has been under the drug side of the FDA. It was under the devices side. So we're looking at this for the first time, your therapy. We don't know anything about this. And they literally said that to me. They go, but you're putting someone in a chamber, you're increasing the pressure and you're increasing the oxygen. You got two different things going, and maybe one's effective or the other, both, neither. We don't know. You're asking to do a study at one dose of pressure and oxygen. You got to do 20 with different pressures and oxygen. This is what people criticize the FDA about. These guys are crazy. Because I'm the expert. I've been in this field 26 years. Pressure. I went to the library. 50 years of elegant research done by the PhDs that the MDs never read, showing that we are all sensitive to pressure and that our body has bioactivity to pressure changes. So what we're doing, a dual component drug, increased pressure and increased oxygen, we're having effect on disease processes that are common to a wide range of diseases. And this lack of understanding of that has led to all the criticisms of it. Well, you claim it works for all of these therapies. Why? Yeah, I do. Because we're treating the underlying disease processes that cause them. And those are common. Most of the disorders are wounding conditions or inflammatory conditions. Most of the pediatric neurological conditions can be considered wounding conditions in the brain. And there's now enough evidence that I can tell you it's evidence-based medicine to do this. And it's a responsible, good decision should you make it. So, that's it. Thanks. And I think, where's Rhonda? She wanted to say something. Rhonda, I don't know where she is. She wanted to make a closing statement. I'm not going to sing and dance until that. No. Oh, okay. Questions? Anybody? Yeah.
So my son he's 16.
16. Uh-huh.
Starting at 4. I talked to you briefly last night. He got stem cells and hyperbarics.
Right. He got stem cells and hyperbarics with Dr. Steenblock, yes.
So those first 2 treatments, but we could never stick. We would go for the summer.
Right.
In Arizona and in California. We would stay for 6 weeks. My husband is a school teacher.
All right, so you go for 6 weeks at a time each summer, yes.
We could never do 40 treatments.
Right.
The most we ever did any summer was 20.
The most you did was 20, okay.
He's now 16, so we're many years out.
Uh-huh.
I'm just wondering, I don't know if hyperbarics helped him or not, to be honest, because it was done with stem cell treatment.
Well, that was the question I was going to ask you to answer. Yeah.
So I'm wondering.
Well, no, let me hold on. We don't know that stem cells have an immediate effect, okay? And I think that is a general consensus. Most people say at least a month to 2 months before you can start to see effect. We now know if you do couple it with hyperbaric oxygen, you can see an early effect. But so did you see an improvement in the time you were there?
I did.
Okay, so you saw an effect from the combination.
Literally, it was like God's hand touched his body and his GI system for the first time ever.
Okay,
So he was out of diapers.
good. So you did get a benefit from the combined therapies, but you're right, you can't separate.
And so I guess what I'm wondering now, I've never done a SPECT scan. I don't know what that is or what that entails. And
You don't have to.
how would I know if this was this many years past?
Okay, how many times have you gone and done hyperbaric treatment?
We did 6 summers of that.
So he's done about 120?
We didn't do 20 each time. It was 14 to 20 each time.
Okay,
And then he did a soft chamber, but I don't think they did it well. I think he was getting ill in there. He could never even stay in the hole.
okay. Well, the whole question though is if He seemed to get better with each time. And did you do stem cells each time? All right, you can't really answer that question. But he still has problems, correct? I would tell you he likely still could benefit from it. But if you're trying to answer that question, and that's the problem, I don't usually do combination therapies until we've got a clear-cut answer that is improving the patient. Because it's got, it's expensive. The relocation, time, energy, resources, all of that. And then the downstream one is, do I do more? Or do I even get a chamber, et cetera? And so you really need a clear answer. So I wait till we get that. And I would just encourage you, if you want to answer that question still, and you can, you don't necessarily have to do the SPECT. I mean, it's nice, but how cooperative is he? Okay, because I could look at this live with quantitative EEG in the chamber and look at 5 different doses in the chamber with him. See, with the SPECT, it was SPECT, 1 dose, re-SPECT. Suppose we didn't see improvement. Is it a dose problem or his brain not going to respond? We don't know. So try another dose. It's another SPECT. Another dose, another SPECT. Well, these things, you can't get the insurance companies. Most of them don't want to reimburse for them. Maybe they'll do one. But the cash price for them is about $2,500 each. So, I mean, it gets prohibitive, and I don't do it. The legal cases where you have to prove something, yeah, but otherwise, I would just tell you, take a period of time, forget the stem cells on that time, and do hyperbaric treatment. Or you can come and we could do QEEG with him. If he's cooperative, you said, he can close his eyes. That's all he needs to do. Record with eyes closed. Yep. Technically, yes. Reality, no. Meaning they will tell you an untreated collapsed lung. In fact, we've treated one of these with hyperbaric oxygen. There's a way you can do it. But that's about the only one. But the thing, an untreated collapsed lung, you know you have it before you put anybody in the chamber. So the group of people you have to be concerned with, there's a thing called spontaneous pneumothorax. So people, and they're usually very tall, thin people with a very narrow chest to back diameter. And people with that body habitus, they have found, have little blisters, blebs on the top of their lungs. And these things can rupture at any time. And they get a spontaneous collapse of the lung. But usually you know who they are because they've already had one of those episodes. If they do, those people, you don't want, well, it's a risk issue. If they go in a monoplace chamber by themselves and they have one of those rupture, you got a problem because bringing them out is going to make them worse. So you have to do it in a chamber where there's an inside attendant. So if that did happen, which is exceedingly rare, they'd be able to do something about it, decompress them. Otherwise, there is almost no contraindication. All of the relative ones you can accommodate with changes in how you operate the chamber and deliver the hyperbaric therapy. Sure. Yeah.
Any advice on, like the kids, a lot of our kids can't blow out their own ears to pop them for the pressure. So is there any advice on what we can do to help them do that?
Well, yeah, and we talked about this. There are a bunch of things. The reality is that in the first 10 years we did this, we had to put PE tubes in about 30% of the children. We don't ever do it now. It's a technique issue. And so it was learning how to treat them and go slow enough. And then they adapt. They will start to learn and swallow on their own. But in the child who still is having a lot of problems, you can try to prop them up more because when you're flat, your venous circulation is the level of your heart. So blood vessels are a little more engorged. When you're sitting up, all your venous blood that's bringing it back to the heart has gravity and the blood vessels are not distended. So the mucosal lining of your little eustachian tube that goes to that inner ear space is flat and it's easier for them to clear the ears. The other is you can use a decongestant. Now, depending on the problem. So if you have an allergy problem, antihistamines are good. The non-sedating antihistamines preferably because you don't want them all drowsy. You're trying to find out if they're going to improve neurologically. But you can use an antihistamine and a little decongestant even.
But that moving their mouth to get them to swallow, that helps it?
Oh, of course it does. In fact, you can even have them drink a little bit if they're at that level and can take oral intake. They can drink a little bit. Actually, the babies, because they can be pretty irritable, but it's really good first times that they go in that they're crying or they get upset because what are they doing? And it opens their jaw, it pops their ears, and they're able to do it without any problem. So yeah, if you can get them to swallow in any way, that's good. Or sucking on a binky, swallowing mechanism. Yeah.
So I noticed a lot of the cases that you focused on were focusing on the temporal lobe image. Have you...
Well, okay, I had you focus on that, but almost all of them were global injuries. These are global brain injuries. No, it's just that I was trying to show you the areas that were more deferentially injured, and of course give a bigger change on that. That imaging, that three-dimensional surface thing, you take a certain threshold for the counts, and below it, it gives you a hole. Above it, it gives you, the picture that you see. So it kind of exaggerates a little bit, but no, these are almost all global injuries to the brain. Encephalitis, trauma, air embolism,
So
yeah.
would it matter if all the damage is parietal or occipital?
Would it what?
All of her damage is parietal and occipital, so it wouldn't necessarily matter.
Well, but wait a minute. What was the cause again? Tell me.
It was viral miniature encephalitis.
Okay, but wait a minute. That usually affects the whole brain. And
Based on the MRIs, that's
The-
That's where the death is.
that's where the death is. Yes. Are they showing dilated ventricles, enlarged ventricles, or atrophy of the brain? All I'm telling you is that the virus doesn't know it's a parietal lobe. It's just their peculiarities about blood flow and whatever else where it does infect and do the greatest damage. What you're seeing is the damage on MRI imaging where it has killed area of the brain and you've got shrinkage. But you can have microscopic damage to the rest of the brain and not pick it up. MRI, you've got to have about a 2 millimeter area of dead brain tissue before you can see it and call it. If you were to do a functional brain scan on her, I will guarantee you'd see one like some of those, where maybe not as bad as some. I'm just saying she's, smiling and all of that, but I'm just saying you will see a more diffuse process. So, yeah. And remember what is showed on the anatomic imaging, the dead areas. When you do the functional scan, there's activity in there. There are brain cells that are alive and can be stimulated. Sure. Okay, where's Rhonda? Oh, I'm...
Just have one quick question.
Yeah,
Speaking on MRIs and specs and everything like that.
yeah.
What would you say on an MRI with a brain bleed, and then on the other side of the brain, there is a speck, but every single doctor just said that must have just been dirt or something in our scanner. That's not actually anything in the brain. What?
Wait a minute. So your child had a brain bleed.
Our son was run over by a truck and trailer and brain bleed, yes.
Okay.
On the right side, about right here, and then on the left side, about right here, there was a black speck that they said wasn't big enough to be a brain bleed, wasn't anything, it had to have been something affecting with their sensors.
Repeat the MRI. If it's there again, and it's artifact. But artifacts, did you get the actual interpretation of the MRI? Not what your doctors told you, what was dictated by the radiologist.
That was the radiologist came to me and that was exactly what he said. And that's what it says in the paperwork too.
That it is an artifact? Okay.
But he
Well,
didn't really seem very confident with it.
okay. I'd have to look at it to see, but a traumatic brain injury is a diffuse injury to the brain. What they're seeing, so look at all the people with concussion, all right? You have a concussion and you're still affected, or not. You know, you can have your symptoms for however long time, but let's say you go to the emergency room. They do a CT scan. What percentage of concussions show an abnormality on CT? 3%. Let's say they have MRI available and they did it in the ER. What percent show an abnormality on MRI? 12%. With diffusion tensor imaging, it can be as high as 40%. But you do a brain blood flow study and you're going to see it in almost all of them. So,
You recommend I do a repeat MRI?
yes. Well, what do you want to look for? He's got a diffuse injury just by nature of it, okay? And you can repeat the MRI if you're trying to answer the question about, is this artifact or is it part of the damage? But suppose it is damaged, what could you do about it? The only thing you can do is still treat it. And he's got, you know, a bigger area already. So, sure. Yeah. You have to leave? We have to go? I got all day, but
Maybe
no, I'm just, yeah.
we'll let you go to your room if you want, like in 8
All right, I'll go to my room. Time out. All right, you time out me. All right. Yeah, I know what you mean. Okay, sure.